Hi and welcome to Season 2, Episode 8 of In Conversation with a CEO. Today I'm joined by Alice, who is a learning disability nurse within the organisation, and we're going to hear a bit more about learning disabilities in general and a bit more about what's it like to be a learning disability nurse at LSCft. So welcome, Alice.
Hi.
Could we start by just, how did you get into being a learning disability nurse and what's it like? What does a typical day involve, if there is anything such thing as a typical day?
Yeah, so I became a learning disability nurse in 2019. So prior to that, I was a support worker for adults with learning disabilities and really loved that job and kind of wanted to progress in my career with
Brilliant.
that. So I joined the Trust in March 2020, working in a children's learning disability team.
Okay.
So I think the thing that I really like about this job is that there's not necessarily a typical day.
Okay.
It's a very varied job. So the kind of support that we offer children and families is very varied. The kind of first line of intervention that we offer is a lot of groups. So we offer support around behaviour, sleep, sensory needs, toileting. And then following that, there's interventions that we'll offer more on a one-to-one basis.
Fantastic. And you are in the Preston area of the patch?
So we cover Central and West Lancashire.
Okay, fantastic. And so talking about children with a learning disability, what barriers may they face and how do you help them and their families overcome them?
So I suppose one of the main barriers that children with a learning disability face is around communication. So we work quite closely with our speech and language colleagues to support around different ways that we can adapt communication.
Okay.
So a main issue that we support families with is around behaviour.
Okay.
And when we talk about behaviour, we talk about all behaviour is a form of communication.
Right.
So when we're working with families, it's around understanding what that behaviour is trying to communicate and how we can work towards getting that need met in a different way.
That must be so supportive to the family. And do you work in with schools as well? How does that interaction work with education?
Yeah, so our support is primarily there to offer to parents and families and carers, but we do link in with schools a lot to do observations, to kind of see what behaviour support plans they have in place. So we are closely linked with the schools in our area.
That's fantastic. And we hear a lot about learning disability or learning difficulty. Just explain the difference and what people should understand about both.
So our criteria within our service is moderate to severe learning disability. Okay. So there's different ways that we might assess that eligibility. So we'll always meet the child and we'll get an idea of their kind of cognitive ability through different assessments like an educational psychology report, an EHCP, which is an education and healthcare plan. Yeah. But the difference between a learning disability and a learning difficulty is that a learning difficulty is things such as dyslexia, dyspraxia, ADHD, and there are often tools that you can put in place that aren't going to affect that person's intellectual ability. Okay. Whereas a learning disability is more of a lifelong condition and somebody's more likely to need support for various aspects of their life throughout the lifespan, although it's a massive spectrum depending on how much support they will need.
Okay, that's really helpful. And we were talking before about COVID and how that impacted. And when you're meeting the children, I take it that's face-to-face, or do you use the digital means as well?
So during COVID, a lot of the work that we did was online, and that was a barrier for a lot of children. Yeah. So we use reasonable adjustments, which is a key thing within the field of learning disabilities. Okay. The groups that we ran, again, during COVID had to be online. However, we're now starting to run them face-to-face, which is a lot more effective. Parents' feedback has been a lot more positive with a face-to-face group.
And that's a group, so you've got multiple children, So the groups are primarily parenting groups. Okay. We do run some groups for
post-diagnostic autism for children with autism.
Okay.
However, a lot of our groups tend to be directly with parents. But in terms of the interventions that we do with children, that does tend to be face-to-face. Yeah.
And that those parenting groups, parents must get an awful lot of support from yourselves and your colleagues, but also from other parents in similar situations, and bringing people together, and that connection must be really important.
Definitely. So that's one of the key things that we get out of running the groups. We always are, we sometimes are able to offer a group versus one-to-one intervention versus an online option, and parents tend to go for the group because they make those connections with other parents who are going through similar difficulties. And today, for example, I was running a sleep workshop with some parents, and one of the parents was talking about how a child struggles with transition, so moving from one activity to the next. Okay. And the parent said, well, this is the strategy I use. Why don't you try this? Okay. So they had that really nice interaction. And although we're there as having that kind of understanding and evidence-based, they're there with that real life experience that they can share with each other.
That's really good. So just talk to us a bit then about your day to day. So you've just been running a sleep course for children, and that's with parents. Just talk to us a bit about that. What were some of the questions that parents would ask you as part of that?
So, for example, today it was a sleep workshop. So it's a workshop that we've developed with some sleep practitioners within our team over the last few years. So that falls under our physical health model of care, which we've been developing as a all-age learning disability service over the last few years. But within that workshop, it's helping parents to understand the evidence base around the different strategies that we're going to suggest around the children's sleep. Okay. So this week we were focusing on more practical strategies. So thinking about routine, thinking about strategies around encouraging the children to self-settle. And then at the end of the group, we always tend to give parents a little bit of homework. Yeah. Self-care is a big thing that we often try and encourage for parents, but always making, this week, for example, it was getting them to think about, well, what different routines are you going to try and implement over the next week? And what we like to do with a lot of our groups is leave a period of time, maybe over the holidays, where parents can take some time to implement a plan, and then we can review after a few weeks and see kind of what support they need.
That's really good. And so you've also done another program, a leadership course around toileting.
So it was a leadership course, and within that, they asked us to identify an area of service development. Okay. So I identified that the link between our service and our local bladder and bowel service may need to be improved. So I did a learning disability awareness session with the bladder and bowel team. And then we've now got a bit of a joint pathway. So we have a monthly forum where we discuss any joint cases. Okay. And now we've also developed a toileting workshop, which we're due to pilot in the new year. So that'll be for parents with children with learning disabilities who have toileting issues. And again, that's a 4-week workshop with a break in between to implement that toileting plan.
That's really good. And was that nurse leadership program, was that through the trust or through
so that was through the Foundation of Nursing Studies.
Fantastic.
So the FONS. So it was around about monthly sessions where we understood a little bit more about leadership, and then we're encouraged to kind of think about our service and the strengths of the things that we can improve on and what areas of development we could identify.
Fantastic. And you're also starting a new program yourself in January. Yeah. Do you want to tell us a bit more about that? Yeah, so
we have a family therapy service within the Children's Learning Disability Service, which is being there's more kind of start that. So we've got a family therapy service that we have within the Children's Learning Disability Service, and a few people within the Children's Learning Disability Service are going on a systemic family practitioner course starting in January. So within 12 months, we will become systemic family practitioners. Okay. So we are starting to run monthly clinics with families with a family therapy clinic. And within that clinic, it's quite different to the service that we typically offer, because the kind of interventions that I've already mentioned are very intervention and goal focus, focusing on a particular behaviour or a particular area of difficulty that the family are wanting to work towards. However, family therapy is more unique in that it's a bit of a safe space for families to talk about those complex difficulties that they have raising a child with additional and complex needs. Yeah. So it's a gap in our service that we're filling that really is going to make a really big difference for these families.
And because you mentioned there about that wider family unit, and so you've got the child themselves with the learning disability, you've got potentially their parents or the carers, but you potentially also they've got siblings, and how do you support the wider family as well in that? So
with family therapy, we will be offering that service to the whole family. That's brilliant. That's where we call it systemic practice. So it's not just the mum and the dad. It could be grandparents, could be aunties, it could be siblings, because we do recognise that there is a wider system that's there supporting the child.
That's fantastic. And will we see that across the whole of Lancashire and South Cumbria? Or is that something that you're piloting in Central and West?
Yeah, so there's currently a family therapist that is holding clinics in each of the areas across Lancashire.
Perfect.
And with a few of us going on the course, that will mean we'll be able to hold more clinics.
Perfect. And including forward. South Cumbria as well?
I'm not too sure. I think it's just...
So we need to check around.
I think so.
To make sure we've got that full provision.
Yeah, definitely.
That's really good. So if somebody was wanting to get into learning disability nursing, or be a support worker in learning disability, or just wanted to find out a bit more about learning disabilities, how do you go about that? What would be your advice to them?
So there's a website called learningdisabilitynursing.com. On Facebook, there's loads of different groups. So we've got Positive Choices, which is a conference that's held yearly, but they also have a very supportive Facebook group. There's at ldnurse.com. On the NHS website, there'll be information about what learning disability nursing is.
Yeah, I think we've got links on our website as well.
So I also did a video, which was a project between NHS England and Down syndrome, that was released around sometime this year. So that takes you through a bit more in depth about a day in the life of a learning disability nurse. But I know on the Down syndrome website, they're really encouraging learning disability nursing. So they've got a lot of links to different ways that you can find out about learning disability nursing.
Fantastic.
But it is a very varied career. So my career is only kind of one drop in the ocean of learning disability nursing. It's a very varied profession in that you can work from birth all the way up to older adults.
Yeah.
You can work in the community like I do. You can work in schools, hospitals. It's very varied. There's something for everybody.
Really good. And I think it's got an amazing career pathway as well. If you think our chief nurse before Oliver joined us was a learning disability nurse and always talked really passionately about learning disabilities. So there's lots of different routes, and on the Positive Choices website there's a lot of very advanced and people who've worked in learning disability nursing for many years that share different resources and information a lot of the time. Sounds a really supportive group.
Yeah, it definitely is.
Fantastic. Well, thank you so much for joining me today and talking about learning disability and especially children's learning disability. It's something, that we're really passionate about here at the Trust, so it's fantastic to hear and meet you.
Thank you very much.
Take care.
You too.